이민왕후台中 비는 EOC. I asked Donna our issue. Thank you give us interesting talk about the civil and military cooperation for disaster. We know it's the original country like mainland China, Taiwan, and Japan. During the disaster, assign the military to help the people manage the disaster. Do your government have any criteria to assign the military? Do you have any criteria?
Thank you for your question. Yes, criteria for assigning our military specifically to a disaster, is that your question? What we do in the United States, we have different categories of military. So we have the National Guard, which is owned partially by the state as well as the federal government. So the first level of response is in our National Guard. The civilian community is, of course, in charge of a disaster, but in the military would first call out the National Guard. That would be called out by our governors. Then, in the event of a disaster that's larger than the states, the way we decide who responds is that the states have to be overwhelmed before they call federal resources. Now, our military does have a number of units that are primarily missioned for disasters. So we have what's called civil support teams, and those teams will be available to respond to disasters. But we don't have large organizations that have as a primary mission a response. For example, our divisions are primarily organized to go to war. And it would be a secondary mission to respond to a disaster. We've gotten a little bit better as to identifying those missions so that we do get some funding to be able to be trained and organized to support. But the primary is always to, for the larger organizations, is to a war, a conflict. Does that answer your question?
Just to add to the answer, as General Barbish mentioned, the way we are organized in the United States is local, state, federal. So once local resources are exceeded, the state, which has a National Guard, can come in to help. When state resources are exceeded, the federal level comes in. If there is a federally declared disaster, if the President of the United States declares a disaster at the federal level, we have something, an authority called the National Response Framework. And within that, there are a number of emergency support functions. For example, emergency support function number 8 is health and medical. In each case, some are for transportation, some are for sheltering, each one has a different function. In each case, the military can play a support role. In each case, there's a lead federal agency. For example, Health and Human Services is in charge of emergency support function number 8. But the military is never in charge for some of the reasons that were mentioned before. But because of the resources of the military, in each of these emergency support functions, they play a support role. And when the President declares a disaster, and those are activated, the lead federal agency can request support from the military. If the military is able to provide it without degrading their primary wartime mission, then that's how we can pull the military in to assist in disasters.
Does that?
Basically, require the military, and the secondly require the civilian to help the disaster response.
I'm sorry, say that again?
Basically, primary response for the military, and secondly, lead to the civilian to response.
the primary for the military is military missions, okay? So while what Dr. Koenig identified is the disaster framework that we have in the United States, every single emergency support function had military as a supporter. But once again, because it's not our primary mission, there is not the incentive of funding and training so that it's not as well synchronized as it should be. If I were given the leadership position, I would try to find a way to have the mission more clearly stated as a support mission so that we had a little more funding going into that, and therefore the commanders would have better experience so that they would be there more readily available. Does that make sense?
Another example would be that through the National Disaster Medical System, if we need to move casualties from an affected part of the country, say a country that was hit, California was hit by an earthquake, and we didn't have any hospital capacity, and we had to move patients to another part of the country, we would use military aircraft as the first line to move those patients. If those military aircraft were unavailable, for example, in Iraq or somewhere else, we might not have that military resource available to us during a disaster within the United States. So these are considerations.
各位还有什么问题没有
？Dr. Xu from Centennial University Hospital. I have a question to the Dr. Kim Miller. I'm interested in the field triage. Do you have any high technology instead of the triage tech for in the field triage, just like the RFID barcode or wireless? And is it reliable? Because in my research, not stable. Thank you.
Right, technologies in triage. That's where things are going. At the moment, I'm not aware of any well-tested or practiced techniques yet. However, there are some triage strategies out there now that attempt to combine both acuity and survivability. The thing called the SACO triage, for example, that works those together. The challenges are with, as you get more sophisticated in trying to predict outcomes, you need more data. And the questions, the data you need to get better predictability may not be available in the time frame you need it for emergency triage. Now, transmitting that data, though, is a dimension that's probably more realistic for the near future. Simple things like barcoding has been used to help identify patients by acuity, as well as by something that identifies them as a person, either name or something. But then better ways to transmit the information you have at the scene to give even as simple as numbers of individual triage acuities to a wide area of hospitals so they can begin to plan ahead and think ahead. That certainly is more achievable in the short term. So I would say probably technology solutions to transmitting information to healthcare systems is probably more immediate. Technology solutions to predicting survival and therefore in doing better triage may be a little further away because of the challenge of getting enough data to do that effectively.
不知道大家还有问题要问我们的今天的 speaker 吗？机会应该是很难得哦。好。
I have a question to Major General Donald Marbish. First, when the military has no significant resource but significant capability, could say that what we should do. Second, who is the leader during the period of civilian cooperation advice?
Thank you very much. Very good questions. We have within our military organization a director of military support. The structure comes under our joint forces so that what we find when we're planning for the disaster, we have an emergency management coordination group, if you will, in our joint forces within the Pentagon. So that commander helps coordinate where those resources go. When we deploy forces, we actually have a command and control structure within the group that's sent that becomes the leadership. If they go, let's say, to a state where there's state control, we can put forces under the operational control of the local commander. But it has to be specified as a group goes how we deliver those resources to another command. We never send somebody into a response environment without defining who their leadership is. Now, having said that, if I send an organization, let's say a number of medical support groups to a disaster, as Dr. Koenig mentioned, our National Disaster Medical System, we will pull in military medical personnel to go to a disaster. In that group is identified as the commander, and those people report to that group and then coordinate with the on-scene commander. In our organizational structure, we have a military coordinating officer who will work in the emergency operations center of a disaster. So the structure is there. As a matter of fact, the military coordinating officer is in the EOC from the time that they decide that the disaster is large enough to incorporate a military response. Now, for example, in Katrina, what happened was they actually pulled an entire command and put a 3-star general in charge of the response. But that wasn't until the president felt as though there was significant problems with the disaster and needed some military support. The unfortunate part, again, you have to be careful what you ask for, because when that general went in and tried to identify how to manage the Katrina response for the military, a lot of the civilian capability that was already engaged was pushed aside, and then the military took the response under their command and control. So while there was some coordination with the civilian community, my personal assessment is because we don't work well enough together ahead of time, many times the activity that you all may have done that was very good and well coordinated, but just not enough, might be pushed aside when you bring in the military, if you don't have that relationship built to start with.
谢谢General Barbish。另外还有一个有问题。
我用中文呈现我的问题。我想请问那个 Miss Greg，他说那个护理人员啊，对所谓的 homemade， 就是说人为的灾害都不太有意愿去反应。那如果说今天这个事件要是发生的话，那当作一个 member 一个护理人员来讲，我是有权利说不要去反应嘛？那如果说用一个在医院里面的人来讲，我怎么样确保我真的是叫到我需要的人？我的问题。
Sorry, I didn't get the question. Could you just repeat that one more time? Good question. The right to say no. Again, we have to go back to, is that nurse going to live or die? The idea behind all of this is to set up systems to protect all responders. And so whether they have a requirement to go or not, they do have a duty to care. they do have a duty to respond in a way that they are comfortable with the response that they're going to. So if they respond, it is under conditions that are safe for them to practice and that provide security and protection when they do respond. And so it's really a multifaceted question, and in order to respond to that appropriately, I have to say that in order for them to respond, you have to set up systems that are going to protect them, give them information about what they're going to face, and give them the mechanisms and the supplies and equipment to protect themselves when they're on duty. So they should respond, yes, but we have an obligation to support them in that response.
And that's what I meant by crisis and emergency risk communications. If we give the people the tools to understand how to protect themselves, they're more likely to do so and to respond. And the other issue I wanted to mention is we have to always think about human behavior, psychological issues. We have to understand that some people, a certain percentage of people, will not respond. And when we plan, we have to account for that. So whether they have a duty to respond or a right to say no, a certain percentage of people will not respond. And when we make our plans, we have to account for that.
In addition, I think there's some important issues to consider. Many times when we do exercises, the managers of the departments will say, well, of course our personnel will be here. They sign as a condition of employment, a letter that says they will respond. But the data has already told us that they will not. So the question becomes, can you say no? As a condition of employment, if you sign a letter that says you will, then the discussion after the disaster, you may say no because we can always say no, but after the disaster you have to consider the consequences, which means you've signed a contract that said you will, and if you did not, now we have to prove for you on your side that you had a justifiable reason to not respond, which could go back to the fact that safety and security wasn't there. But by the same token, if you don't respond and safety and security was there, now it may be that your job is in jeopardy after the disaster because you did not respond. And I think it's important to consider too that during Katrina, if you remember the reports, there were medical personnel that abandoned patients, and they were later brought up on charges of abandonment, and some of them actually went to jail for having abandoned patients, when in fact their safety and security was at risk, but there was no one to help evacuate those patients. So consider what would happen if you are in charge of a number of patients. Nobody's coming to help. Your patients are at risk, but if you stay with your patients, you think you may die. Now what do you do? And in this case, in retrospect, it was determined that they should have stayed with those patients. So this could be something very critical for us as medical personnel to consider in the future. And I don't think there's any easy answers right now about that.
我们在座应该有一些护理同仁哦。那刚才那个 Dr. Brady 他的演讲会有一些把我们带回我们在SARS时期的一些情况。请我们的护理同仁也想想看，你们要怎样来发言哈？那我其实是我的这个情绪是有点被带回到那个情况的哈。我的研究其实它的结果跟 Dr. Bradley 讲的上课的内容，尤其是刚开始那个投影片，有非常多的类似的情况。那不过呢，我们在那个发现里面觉得，leadership 是非常重要的哦。还有就是说，医院里面资讯的透明化也非常的重要。 我又知道我被送进去一个危险的地区去照顾，那么我是不是可以保证我是安全的？医院里面的设备跟设施是不是足够的，支持我来做这件事情？那我记得当时我们有一些护理长，他做得非常好。譬如说 PPE 有没有穿好？我们护理工作同仁，包括那个清洁工，他要进去到病人的病房里面去的时候，他说：“来，我检查一下有没有穿好。”结果检查一下说 ：“OK， 你安全了，你进去。”让工作人员觉得他非常有安全感。好，那另外就是说，我要用的东西够了。好，那还有医院里面发生了什么事情？我们有没有同事被感染？这个资讯是非常重要的。这个是 support 他说，他在这个危险的领域里面，他是不是真的可以继续做下去的？他值不值得这样子做下去？所以这些其实都是非常重要。那我觉得在当初也是有些护理人员，他为什么他会拒绝？因为他受到周遭的影响太严重，家属甚至于连那个小朋友不可以上学，因为你妈妈在医院工作。这类的事情太多了。还有就是在他的同侪里面，有些人不愿意进去。为什么都是我们护理人员要进去？为什么医师会不进去？他可以在外面order，他可以透过这个资讯，对不对？他可以来 order 我做什么做什么。他为什么不进去？为什么 RT 不进去？为什么只有护理人员要进去？这一类的事情都会引起护理人员为什么他不愿意去做这件事情。事实上，护理人员他对这个 patient care 对医院他的 commitment 是非常的够的。那其实我们经过 SARS 这件事情以后，做了很多这一类的这个资讯的整理像我就是用 focus group 去问出来这个东西，而且我不敢自己去主持，我自己去主持绝对完蛋，听不到这些真实的声音。那还有透过问卷这样来的一个结果。所以刚才 Dr. Gray 的演讲让我真的是有非常深的感触了。那至于说人为的灾害，护理人员不愿意去 care。我们一天到晚急诊杀来杀去的，那也是人为的灾害呀。护理人员也没有人拒绝呀，对不对？所以重要的就是说，你这个工作环境有没有保护到我们的工作人员？这是第一点重要的事情。还有 overloading 的问题。那其实在一个很紧急的状况之下，我想应该没有人会去拒绝照顾才对了。好，谢谢。那我们的护理人员准备好了吗？有没有人要提问题？请。
This question is for again General Babish. I would first like to identify myself. I'm affiliation with the Ministry of National Defense. I'm in charge of HADR mission. I'll give you my perspective about Taiwan's military involvement in domestic disaster. It's a little bit different from your country because we currently have two major wars, Iraq and Afghanistan. We don't. Country is relatively peaceful. I here have one statistic in the year 2005. Out of 63 so-called federal declared national disasters and federal incidents, emergency incidents, there are only 5 participation by active duty military by the United States. The year Taiwan is totally different because in Typhoon Mark 2 years ago, our defense minister, Mr. Chen Zhao-ming, because of the so-called poor perception of military's performance during the relief efforts, he was fired. And ever since then, we have amended the law, so the 灾害防救法, the Disaster Prevention and Protection Act, specifically the paragraph 34, Article 34, 34条, 第3项, paragraph 3 states when the disaster has already overwhelmed local and the county's capabilities, the military should and must step in, even without request. So here comes a very touchy issue, because you have the so-called Stanford Act, that only presidential declaration was announced, can federal military step in. But here in Taiwan, the military is asked by President Ma Ying-jeou as chief of the commander that you have to step in. Sometimes we overshoot, because we constantly have to so-called position our vehicles, our equipment, our medical staff prior to disaster. If it is a notice or things like typhoon, things like that. My question is, how do you eliminate so-called stone piping phenomena? Because military has to do what with the Department of Health, CDC, we have to work with NGOs, voluntary organizations. We have different culture, different language, different standards, different. How do you integrate communications, language, things like that? Thank you.
Very, very good question. The military is a different animal. And first let me back up and say, in the United States, because of our Stafford Act, and because of our Constitution, the way we're organized, every state has rights to do their own emergency management. Public health and safety in the United States is a state responsibility, not a federal responsibility. And because our states have specific rights, the federal government cannot go into a state and say, I am here and will help you without being invited. Now, having said that, if it's an issue of national security, then the president can do that. The president can override states' rights if there's a national emergency. And we have, but very rarely. After Katrina, we did amend the law to say that natural disasters could be one of those emergencies, and maybe made it a little bit stronger language to say that we could. But let's imagine what would have happened in the United States had those levees not broken in Katrina and the hurricane hit, but the flooding did not occur. And if the President of the United States had pushed federal forces into the state when it wasn't a catastrophic disaster, and you don't know, and one of our biggest challenges in disasters is we don't always know what's going to happen. The fear factor, the problems that people have are the same problems we have with organizing the response. So it's kind of a slippery slope. And in the U.S., again, we're a little reluctant to send the military unless overwhelmed at the state and at the local level, and only upon invitation. From my perspective, I believe that if we did increase our military mission to be part of the disaster response, somewhat as you've done here, I don't think we'd ever be quite as strong as that. But again, our president has the authority to do that. Have they also given you the funding to coordinate your military response? So they have increased funding to help you do that. Well then, if I had some funding to push our military to coordinate with the other organizations, I think that would be a start. At least I could pay my people to do some more of that. But one of the problems is, if I'm the Secretary of Defense, and you're the Secretary of Health and Human Services, and you're the Secretary of Agriculture, and you're the Secretary of... Sure. Who's in charge? And the military can't tell the Secretary of Health and Human Services, I'm coming over to coordinate with you, and you and I will work together. It has to be a collaborative thing. And with our cultures, it's a very, very difficult thing. Again, the military mindset is, I used to sit in the Pentagon at big tables where lots of generals and senior executives were pounding their fists saying, we fight and win the nation's wars, we do not do disasters. This was before 9/11. And they were adamant that we are not going to be pushing military within the United States ever. And yet, after 9/11, we were there. And having done a lot of research in this area, I was saying to them, but tell me what war is, because on 9/11 that was an act of aggression, and our Constitution says we support and defend the Constitution of the United States against all enemies, foreign and domestic. And yet they didn't agree with me, but we're moving forward, and I think it's a very slow process. I think we have to be very patient, although if another event occurs, what justification do we have to say to our citizens that we weren't there because we had to take our time and slowly walk through the cultural differences between our military and our civilian communities? But I think that's what we have to do. And change is tough, but change should be embraced. Like one of my friends said, change isn't bad. Babies cry for change. We change them and they're happy. So change can be good, and it's just something we have to do. But I think it's going to be a bit of a challenge when you're told you must. We're not quite there yet in the United States. So I wish you good luck, and if I can help, call me.
One of the themes that you're hearing is that we have to have authority and also resources. And I mentioned that the Department of Veterans Affairs has a statutory mission for emergency management. When that first came into play, there actually had to be legislation. That whole infrastructure is there, all those personnel, all the supplies. For example, the VA supplies the contents of the Strategic National Stockpile. But before VA could take on that mission, because VA's primary mission is caring for veterans, there had to be a law, and not only that, they wouldn't allow it until the Congress allocated money to support that mission. So this is a recurring theme, is you have to have the authority and the resources to support that authority before you can do that mission.
我们在座有洪波跟风灾的苦主啦，不知道我们秀君科长要不要从风灾的经验跟我们？很客气哈。请问还有没有其他的我们的同仁要发言？请。
我是成大医院急诊的护理长，叫手了。其实很感谢几位讲座的演讲。那刚才其实，我听到护理这一块的时候，我自己就好像回到那个时候了哈。那我很想了解，因为我们现在都在讲面对的时候，那我们现在结束的时候，我不晓得各位有经验的一些学者啦，或者是一些很有经验的人，在后面我们怎么去支持这个人？这个已经受过就是这个创伤后症候群的人，不晓得在国外的经验，他们是有是常规的有办这样的 support 的 system， 或是说是一个 program， 或者是说就是碰到之后我们再来处理这样子。我想请教说，在美国的经验，甚至日本这一块再怎么做？那我们台湾是以后也可以这样子。那当我们在出去的时候，我可能会比较在下，或是说我比较会面对这样的不舒服这样子。
We have a number of things that we use in the U.S., and one of the things that we started most recently is something we call psych triage, or psychological triage. And in looking at that, there's a number of factors that lead to situations where the patient might be overwhelmed. And in those particular cases, we identify early on those at risk, and those we have mental health professionals to assist us in the care of those patients. We also have in our disaster response mental health professionals working with us, and their job is not only for the care of the patients, but also for the care of the staff, so that as they're going around, they can watch for staff burnout or staff non-compliance or staff stress and deal with that appropriately. It's also important to think that in disasters, staff are going to become victims and have the same psychological response where they become stressed and have nightmares and everything else about what they did, what they saw, or what they could have done. In situations like that, in our incident command system, you saw in the hospital response, we have healthcare workers specifically there to assist, assess, and treat staff that are under those parameters. In deployments for that, we also have tents where staff can move aside, decompress, and get the help they need to provide a better response. So there's a number of systems that are in place and that work together to improve both the mental health of our patients as well as our staff.